I'm going to start by introducing our panelists, and I want to thank our participants for attending this session. Today we have a great lineup to discuss key decisions in careers in surgery. We have a great lineup with Dr. Susana Vargas-Pinto, who is co-director of the newly established Endocrine Neoplasia program at Norwalk Hospital in Connecticut. The program provides comprehensive medical and surgical care to patients with benign and malignant endocrine disease and serves a large underinsured Latino population. Dr. Vargas-Pinto was born and raised in Puerto Rico. She completed her undergraduate studies in microbiology at University of Puerto Rico in Mayagüez. She earned her medical school degree from Ponce School of Medicine and Health Sciences and completed general surgery residency training in 2019 at the University of Buffalo. She completed a fellowship in surgical endocrinology at the Yale School of Medicine and has since joined to be in private practice as part of the Whittingham Cancer Center Surgical Oncology Program. We also have Dr. Joseph Lopez, who's currently a cranio-maxillofacial surgery fellow and instructor in surgery at Yale New Haven Children's Hospital. He provides comprehensive surgical care for patients with plastic surgery and cleft cranio-maxillofacial conditions. Dr. Lopez is a graduate of Stanford University and received his medical doctorate and Master's of Business Administration from Harvard Medical School and Harvard Business School in 2013. He then completed an integrated plastic surgery residency at the combined Johns Hopkins Hospital, University of Maryland, R. Adams Cowley Shock Trauma Center in Baltimore, Maryland. At that time, he pursued a research fellowship in stem cell and biology, and subsequently pursued his fellowship. Dr. Lopez will become the first integrated plastic surgery trainee to train at the Memorial Sloan Kettering Cancer Center in head and neck surgical oncology. His expertise in research and innovation has prepared him to investigate evidence-based guidelines and treatment protocols for children afflicted with these rare anomalies and cancers. Of note, Dr. Lopez is a co-founder of our organization, the Latino Surgical Society, which is a 501c3 nonprofit organization dedicated to the advancement and recruitment of Latinos in surgical careers. Dr. Gricelda Gomez is also joining us. She's a urology resident in training at the Brigham Women's Hospital in Boston. Although she is known to Gigi to those who most know her, she did receive her medical doctorate and master's in public health from Harvard's Medical School and T. Chan School of Public Health. She is Mexican American, originally from Southern California. She completed undergraduate education at the University of California at Berkeley. Her interests include general urology, Latino health, and health policy. Also joining us is Dr. Melissa Esparza, who's a pediatric orthopedic surgeon at Phoenix Children's Hospital in Phoenix, Arizona. She grew up in Tucson and went on to earn her bachelor's degree from Stanford University. She walked onto the women's varsity soccer team during her time there. She worked for some time in the Bay Area following this and ultimately attended medical school at the University of California, San Francisco. One of her most rewarding activities during that time was participating in the Clínica Martín Baró, a student-run free health clinic serving a largely underserved immigrant community in the Mission District of San Francisco. She returned home to Tucson to complete her orthopedic surgery residency, and she also completed a fellowship at Texas Scottish Rite Hospital in Dallas, Texas, and went on to do additional training in limb lengthening deformity reconstruction at the Paley Institute in West Palm Beach, Florida, and the International Center for Limb Lengthening in Baltimore, Maryland, which is coincidentally where I trained. She is now in practice at Phoenix Children's Hospital, where she treats children of all ages with musculoskeletal conditions and traumatic injuries. And last to be participating on our panel is Dr. Joaquin Camara Quintana, who was born in Northern California. His parents are Mexican immigrants, and he is a very proud Californian. He did his undergraduate training at Johns Hopkins University, where he graduated in 2006 with a degree in molecular biology. He then completed his medical school at Stanford University. His neurosurgery training was completed at Yale University, and he completed also a complex spine surgery and oncology fellowship at Brown University. Dr. Camara is currently an associate professor of neurological surgery at Brown University, where he specializes in complex spine surgery, minimally invasive spine surgery, and robotic spine surgery. Wow, that is a mouthful. If let's do a virtual clap and welcome for our panelists. And I'm gonna go ahead and kick it off for you. If you could just tell me briefly, why did you pick your specialty?
All right, I'm gonna start. Welcome everybody, thank you for joining us. I always loved endocrine surgery, even as a medical student. So initially I wanted to become an ENT because I really love the endocrinology aspect of the head and neck. And I really wanted to be able to train in that field. But unfortunately, I didn't match into ENT, so I selected an alternative pathway. For that reason, I went to train into general surgery. And then from general surgery, I had two options, head and neck surgery or endocrine surgery. And I decided to go with endocrine surgery because options for work after training are a little bit more available and it's a little bit more conducive to what I do. So I thought that I will have better options once training was completed.
So the reason I chose my field was, I'd say, maybe by mistake. So I started off in medicine thinking that I wanted to do something more like family medicine or internal medicine. And it wasn't until November of my third year that I walked into the operating room at the Brigham Women's Hospital with the vascular surgeons, and I just got enamored by surgery. It was just one of those things I knew I wanted to become a surgeon from the moment I scrubbed into open AAA with Dr. Menard there. So once I saw that, I sort of started figuring out like what type of specialty I wanted to choose. And for the longest time, for a year, I thought I was going to do vascular. And I sat down and really thought about what elements I enjoyed about surgery in general. And for me, it was the creativity aspects, the being able to be innovative, being able to have a very wide scope in your practice. And unfortunately, there are only a few fields that sort of provide that. And the general surgery residents actually encouraged me to look into plastic surgery. And I'm glad I did because I found those elements in plastic surgery along the way. It's a very creative field. It's really extremely innovative, very broad scope. So if you're like me that gets really bored easily doing the same thing over and over again, it's actually a perfect field because you get to do a lot of different things in one day. And so for me, I sort of did a self-analysis of my interests and my personality and my skills, and then I tailored my decision based upon what I thought I could be good at.
I can go next. And I guess I have kind of a similar story as Dr. Lopez. I actually went into medical school and kind of always had an interest in pediatrics, and so sort of was on a path towards, doing something just within the peds field, but wasn't quite sure what. And then I didn't actually do my general surgery third year rotation until the very last one of my third year. And so again, kind of similarly, I went, just being in the OR, I realized how much I really liked that environment and wanted to do that. And then I did just a 2-week peds ortho surgical subspecialty rotation. and just loved it. And so I think I was lucky to have some great mentors and support along the way that encouraged me to do that, because I didn't feel that I had at that point really had enough experience or necessarily the numbers to be a competitive applicant, but I had a lot of great support and advice in helping me do that. So I took an extra year to do some research to get some more ortho experience. And I think just one of the things that that I do really like about ortho is just being able to see the difference you can make in patients' lives. And I think any field is like that too. But I think with ortho, it's been really rewarding to be able to see just that tangible difference of helping to improve somebody's quality of life, whether it's just helping them walk better, improving their pain, improving their function, I think has always been really rewarding.
I can go next. So I actually went into medical school very open-minded, but I thought that surgery was actually not an option, but it wasn't something I kind of wrote off surgery initially until I had anatomy in the first 2 years of medical school. Dr. Lopez actually was one of my anatomy tutors, or he just did this on his own. He wanted to get Latinos involved in surgery, and he helped let LMSA students with anatomy, and he made it fun, and I really enjoyed anatomy. So at that point I was like, well, maybe I can start considering, maybe keep my options open. I did volunteer at Planned Parenthood before medical school, and so along of my interests, the interest that I've always had since undergrad was Latino health, women's health, and policy. But a lot of what I liked about Planned Parenthood and my personal experiences with medicine was, I never had talked before I became a urology trainee. I'd never talked to my mom about like urinary incontinence or even sex, like a lot of these taboo topics. And so I find it very gratifying to talk to patients and make them comfortable about very distressing topics that we don't like to talk about. Leakage, being unable to pee, erectile dysfunction. And so that was why I was initially interested in OB-GYN, was my option. But then I realized that I don't like the labor part of OB-GYN, the OB part. And I really loved surgery. And fortunately, I was able to just get exposed. No, I don't think anybody really knows about urology unless you have a urologist in your family or you were exposed to that as a child. I never knew about urology. But fortunately, I was able to get exposed on my OB-GYN rotation to a urogynecologist. And then I realized that there's two different routes to urogynecology. And so then I started exploring this urology, the urology route. And I felt urology was the best place for me because it coincided with my interests, actually, even more so. I loved women's health, and that was one of the things that got me into it. And I felt like actually in urology, I can do more for women. 10% of urologists are women. I know I personally like, when I look for my own doctors, I like to see, where can I find a woman physician, a woman PCP. I have a female PCP. And I actually felt like urology opened up more doors and kept more of a variety for me. I get to see male and female patients. I get to see patients of all ages. I get to see all different types of pathologies, benign pathologies, kidney stones. You're improving their quality of life, or there's cancer, and just like Dr. Lopez said, I like the variety that I'm able to provide in one day. So I can 2 days ago, I did a sphincter for a man who has incontinence after prostatectomy, and then we took out a woman's bladder for bladder cancer. So, and then we did a stone in between. We took out somebody's stone. So it's a variety. It opened the doors for a lot of patient populations. And I think the key thing for me is that it allows me to combine the art of medicine, talking about distressing topics for patients, but also being able to provide treatments for them.
Wonderful. Thank you so much for that. We're going to go ahead and ask Dr. Quintana to share his insight about why he chose to go into neurosurgery.
I chose my field. It's one of those things where, as an undergrad, I got involved kind of early and I was at Hopkins and I wanted to work in the hospital. I knew I kind of wanted to be a doctor, or at least I had the aspiration to. And so I started getting involved in the hospital and shadowing, and I had an idea that maybe surgery would be kind of where I wanted to land. And initially, I got involved in neurosurgery, and I kind of ran with that. And I liked the high pace energy of it, and so that's how I initially got entered into neurosurgery. I tried some other things after, but that's kind of how it started.
And what would you say is your favorite aspect and least favorite aspect of neurosurgery?
Favorite aspect. I guess it's different if you think about the training, and now it's kind of as like a junior faculty person, there's differences to both. I'd say from a training perspective, things that I did like. I do kind of like this whole kind of in the trenches mentality where you kind of have your colleagues, your co-residents, and the bonding that you have with them during the learning process. I think that's, to me, is a pretty unique experience, and both challenging and fun at the same time, to kind of rely on your colleagues and co-residents. Obviously, the surgical aspects are fun. Seeing your growth throughout the residency period. When you first start out, you really don't know how to do anything, and then kind of midway through, you're kind of starting to understand the anatomy, understanding the patients, and you're starting to kind of put things together, and as well as like surgical skills. And so it's nice when kind of things are starting to click, and you get to see the results kind of afterwards. It's a really neat thing. I see the challengings from residency. Obviously neurosurgery is, it's a very challenging residency. So there's a lot of aspects to it that are challenging, both from a work kind of perspective and balancing life. Like with anything, there's always politics, which sometimes can make it a little difficult to navigate. But I'd say it's kind of just time management, and then kind of quality of life is always a little bit of a challenge. But I think I did my homework, and I had been involved in a lot of neurosurgical stuff before deciding, and so I kind of already knew what was up down the road. From a faculty perspective, there's a lot of good. There's not a lot of bad.
Wonderful. So I'm going to ask you guys to segue into that. Tell us your favorite and least favorite aspects of your field.
There's so many favorite aspects of endocrine surgery that I love. I'm going to try to focus. One of the things that I love is the relationship that you are able to build with the patients. Contrary to general surgery, that you come in, you have your hernia fixed, and then you're gone. And then whenever you have another problem, you come in again. In endocrine surgery, depending on who sends you the patients, you may be able to do the workup, share the diagnosis for the patient, counsel the patient, explains all the options that they have. And it gives you the opportunity to actually help that patient make a decision together. Then you see the patient after the procedure, and sometimes patients with specific pathologies, you are able to see like such a dramatic change quickly, specifically those patients with Graves' disease. That is so rewarding. Sometimes they just come crying because they've been feeling so poorly for so long, and nobody had ever told them that maybe their problem could be improved with surgery. So that is something very rewarding. In terms of thyroid cancer, for example, that's something that we commonly see. You're able to continue to see those patients, and you can help them with their monitoring. Sometimes even if they have a complication or issue, most of them can be managed, and they do well. In thyroid cancer, most patients do well. So it's not like pancreatic cancer or things like that. So you're able to share a little bit of light in terms of these people's life. The one thing that I don't really like is that as a new graduate, it's really very difficult for you to have an exclusive endocrine surgery practice. So you may be able to take call acute care surgery call, or right now I'm taking colorectal surgery call, which is fine. We're trained to do that. It's just that I would like to focus my energy for my endocrine surgery patients. But that's something that I knew. So I'm able to accept that for a couple of years and then hopefully build a practice where I can just do whatever I want to do.
Thank you for that. As a fellow endocrine surgeon, I can say I feel your pain. Let's go ahead and turn it over to others to chime in.
I can comment. I'm a very young trainee. I'm still in residency, so there's probably still a lot I don't know. And what I don't like now is probably what I'm not going to like in the future, which is like consults, which I think is a very highly resident problem. But in terms of pathology, so what I love is about urology, which is already I mentioned, is being able to treat a lot of diseases that are pathologies that are that will improve quality of life. So BPH, for example, treating, and what I enjoy is that the first options are not always surgical, and sometimes you can treat medically and solve their, you'd be surprised, solve their problems and keep them not bothered and satisfied for many years before heading to surgical. So I actually really enjoy being able to provide medical and surgical treatment options. I'm sure that we as surgeons, everybody thinks that we all want to just operate, but that's not the case. If we can avoid a surgery, I think that's a true marker of a great surgeon. I'd say is when not to operate. I think that the pathologies probably within urology that are probably the, somebody once described it as the Mondays. Like you have to be able to enjoy what the least desirable pathologies are in that field, whatever field, surgical or medical. And so for urology, I'd say is like recurrent UTIs. There are like the chronic prostatitis syndromes, pelvic pain syndromes. We often see those patients, and they can be very hard to manage because a lot of it is psychological or any pain syndrome, anything related to pain or psychosomatic can be really difficult to treat.
Very insightful. Thank you for that. Dr. Esparza?
Yeah, I mean, I'd say there's a ton of things I love about ortho that sort of drew me to it. I mean, I think one, just the surgeries themselves, there are a lot of like sort of stereotypical ortho things to say that, oh, you get to use power tools and fix bones and make them straight, which is very fun. But I think also just, aside from that, the anatomy aspect of it and the having to think about both mechanical and biological principles to get something to heal. And yeah, just having to have all of these different aspects go into what we do to help someone to get better, I think is really satisfying. And then even again, the non-op stuff too, I think is really great. So even something like treating a dislocated joint, anyone that's been able to reduce a joint, feel a hip go back into its socket, or even reduce a finger back to where it's supposed to be, it's just such a satisfying feeling. Or with peds ortho specifically, a lot of the fractures, for example, we see in peds ortho can be treated non-operatively, and just being able to see that child get better as their injuries heal, I think is really satisfying. I'd say another thing, and probably just in surgery in general, but something that I've really felt in ortho too, is just that team aspect of working together. And I think a lot of that, I felt in residency and just working together with your co-residents, with the surgical team, with the nurses, I think is something that I always really enjoyed, is having that kind of team feeling and support around you. And then I'd say, as far as least favorite, similar to what Dr. Gomez said, we also, I think every specialty has its own aspect of this, but a lot of like the chronic pain patients are very difficult to treat. And I think one of the more rewarding sides of ortho is being able to see patients get better and feel like we can do something really tangible to affect that. And so it's hard when you have a patient that you want to help them, you want to figure out what's going on, and there's no underlying structural cause. And so it can be frustrating both for you as the treating surgeon, and for the patients to not have an easy fix to something. And so I think those are always difficult situations.
I'll go next. So I think for me, my favorite thing in plastic surgery is pediatric surgery, and that's why I decided to specialize in that field. Plastic surgery is extremely wide scope in terms of practice. You'd be doing lower extremity reconstruction, and you're the lower extremity expert. You can be doing transgender surgery. You can be doing breast surgery. You can be doing hand surgery. You can be doing head and neck reconstruction, head and neck surgery. And so it's a very broad field, and that's why I chose it, because I was fairly undecided in terms of what area in the body I enjoyed. So I picked the one specialty where you don't have to choose the area in the body. So, but it also made it hard for me to determine what I wanted to do eventually. And for me, the reason I enjoyed pediatric plastic surgery was because essentially you become that child's surgeon for the rest of their life. If a kid comes in with a cleft, that child will live for 20, 30 years, will go through 20, 30 surgeries to reconstruct their face. And you know them from the time they're born until they're an adult, and you become their family doctor essentially. So for me, that is something that I longed for in my career, being able to have a very long patient-doctor relationship. And so I found that in pediatric plastic surgery. I also found in plastic surgery that it's an extremely creative field. There's no one surgery that we do that's exactly the same. Everyone comes in with a special defect, a special deformity. And what you learn in plastic surgery, you learn the principles on how to address a problem, and you apply your principles and your solutions, and you give that child, you give that patient a very specific solution. And if it doesn't work great, the great thing about plastic surgery is like, there's very low morbidity. And so you can always have a chance to go back and correct whatever deformity or whatever issue they may have. So it's extremely rewarding from a creativity aspect. And for me, that's something that I really find very rewarding and very special in our field. A third element of pediatric plastic surgery is 70% to 90% of our patients are Latino patients. My pediatric plastic surgery clinics are filled with Latino families. And it might be related to a higher incidence of cleft and craniofacial anomalies in the Latino population, and maybe issue with genetics. But so I directly work in the community, even though it's not necessarily set up to be like that. And so you can go anywhere. You can go to Miami, you can go to Virginia, you can go to Utah, and you will have a Latino patient panel, which is really special in pediatric plastic surgery. And there are only 3 or 2 Latino craniofacial surgeons in the country. And so for me, I was like, well, that's easy then. I mean, that's an easy field for me to sort of gravitate towards, because I speak the language. I enjoy helping that population. It's a very creative field. And so that's why I gravitate towards that. So I'm very, very happy that I found that niche within plastic surgery. Now, in terms of what I find least favorite is actually it's not the type of surgery, it's more the perception. Like plastic surgery is one of the most misunderstood fields in surgery. And Minerva's laughing because it's true. If you survey doctors, almost 80% don't even understand what we do. Not even surgeons understand what we do. And so it's a very interesting, unique field. And because you're a jack of all trades, you own nothing. And so, as a result of that, no one really understands what you do. On top of that, everyone thinks we do cosmetic surgery. Yes, it's part of our field, but it's a very small niche portion of our field. For example, on Thursday, we did a cranial vault reconstruction where a kid's skull was born abnormally. And we had to reshape the entire skull with neurosurgery and put it back together so that it looks normal again, and they don't have intracranial pressures that are elevated. The next case was a rhinoplasty. I fixed the lady's nose. The next case was a cleft lip, and finished off with a trauma case that night till 11 p.m. So someone that came in with facial fractures. So it's an extremely wide field. And for that reason, I think there are a lot of misperceptions, and it's a really misunderstood field. So I think that is my least favorite element of that.
I love the enthusiasm, but I still don't necessarily know that I understand what you do.
I know. It's hard to explain, unless you're like live it, it's hard to really explain, But I haven't, like, for example, everyone thinks I do breast surgery. I haven't touched a breast in 3 years. And so, but in the public's mind, we're known as like breast surgeons. And so it's very, very interesting to be in this field. And, there's all these misconceptions and completely misunderstood. I think maybe one day I'll write a book saying plastic surgery, the misunderstood field or something like that,
Okay, Shakespeare.
I just wanted to add too, like with that, and I think as a med student, when you're looking at different surgical subspecialties too, that it can be helpful to also just realize that there is some overlap between different fields. So just specifically to ortho, for example, hand surgery is something that, we share in common with plastics. You can become a hand surgeon either through plastic surgery, through orthopedic surgery, and there are even pediatric hand surgery specialists. Spine surgery is something that we overlap with neurosurgery. And so you can become a spine surgeon either through orthopedics or through neurosurgery. And I think there are different paths to different fields. And I know Dr. Vargas-Pinto mentioned that before too for her field. And so I think that is just something important to realize as a medical student too, to kind of look at those different options, talk to different people in those fields to see like what aspects of those fields also maybe interest you or can kind of is the best path for you to get to that if you know sort of ahead of time that that's what you want to do.
Yeah, why don't we talk a little bit about what does that mean? What is the path? Say, for example, for someone who gets through medical school and now, we just had match. How do we get people to get to where you are? What's that path look like?
I just want to say nobody overlaps with urology, the urinary tract and the genital urinary tract of men. Nobody likes to overlap with it. So that's one of the aspects that I enjoy about it. Nobody interferes with our territory.
Although I've done cystos on
Urologist,
transgender
stay away
patients.
from the adrenals.
Oh, that's true.
On the phalloplasties,
That's
it's
true.
so interesting. I've never done cysto until like in my last year of residency. I was like, wow, okay, I guess we do this too. It's so weird.
I do like the collaboration that we have with a lot of other surgeons. But to answer your question, Minerva, so I do want to note, if urology is what you may be thinking of or interested in, you do have to start earlier than other specialties. So match day for most specialties was yesterday, except for urology and ophthalmology, which I have no idea why it's still that way. It makes no sense, but I think it's just ophthalmology and urology that have an early match. And so we matched our residents back in 2 months ago in January. So you do have to think about it a little bit sooner. But to get to where I am now as a urology resident, a lot of the same hurdles that we have to jump for any residency, the next step, do well on your step 1 scores. I know some programs some medical schools have different curriculums and you do them at different points of time of third year. But for some more competitive surgical specialties, unfortunately, there is that sweet spot that you have to meet. That bar that you have to kind of meet just to get you through the door and make it easier for yourself. Doesn't mean that it's not possible, but it just makes the road a little bit harder. To be specific, I think in urology it's around 230. But I know things have been changing, but that's one. Research is not as a big deal as it is for other surgical specialties, but they do like to see that research is there. Otherwise, I think urology is, they like non-traditional students sometimes, but I think just like any other specialty, once you keep on going beyond medical school, as long as you express a certain, you advocate for yourself and kind of explain why you're interested in a certain specialty, we welcome the people that are interested in it.
Anybody else want to chime in on that? The path briefly to where you are?
I'm just gonna comment that the score thing. I don't know how exactly this is gonna work with the changes in the USMLE. So probably every program will develop their own way of actually screening for candidates. I would just say from personal experience, letters of recommendations matter a lot. It matters who writes the letter for you. If it's someone that is nationally recognized, that certainly helps because everybody knows who that person is. If there's somebody that is not nationally recognized, then make sure that whoever is writing that letter for you actually knows you and can write something more than a generic thing. Most of the time we waive our rights to see that, but you have to be smart and strategic about who you ask for letters of recommendations. Regardless of which specialty you're gonna select, you need a mentor and you need a sponsor. So sponsors are people that are gonna invest in you and are gonna invest in pushing your career further. And they're very difficult to find. I was fortunate enough to find Minerva on my way, and she is basically have been there for me. And if it wasn't because of that, I probably did not know exactly how to get to become an endocrine surgeon today. Mentors can, give you some advice, and they're less proactive in terms of having you succeed. So you always need to try to find those people. So there's always places to look, and we just need to help each other on this. That's basically the 2 points that I just wanted to make, because in reality, people expect surgeons to be in a certain way. It's okay to be different, but you have to show certain characteristics. You have to be self-determined. You have to be able to work well with others. You have to be able to show that you have leadership skills. So things like sports, music, band, and other things in your curriculum tell people that you are able to have those qualities. So that's something to think about.
Yeah, I would agree on all of what's been said so far too. I think specifically for ortho, it definitely is a really competitive field. And so I feel like I've been very lucky to have those mentors and sponsors. And I think the other sort of category too with that is not necessarily always attendings, even sometimes just people a few years ahead of you in training or your colleagues. Dr. Lopez and I met in undergrad, and we're still good friends now, but having people from undergrad, from medical school, from residency and fellowship that I can kind of lean on and ask advice to, along with the attendings that I had, has always been really important. Ortho is definitely one of the least diverse fields out there, so I think the most recent stats I saw from a few years ago, it was 6% women and 3% Latinos. And so it's definitely something that I'd say is one of my least favorite parts of the field, but I think that there's been a much bigger focus on recently, and people that are wanting to change that and advocate for having more diversity in our field too. So I think, the numbers are very important, and unfortunately sometimes the step 1 scores, or now, I don't know next, there are going to be those kind of screening things that you have to pass that basic threshold. But I think finding people that will kind of help you strategize and figure out what's going to make you a better applicant is important. So for me, I didn't have the highest step scores. I didn't get many interviews, but I got interviews at every place that I rotated at, and that was kind of my strategy, and kind of had a backup plan too. But I think just kind of being honest with yourself and realizing what are your strengths and weaknesses, and then finding people that will help you to work with that and help you to be most successful. And definitely agree on the letters too. I think that for me was a huge help as well.
Dr. Lopez, I wonder if you can address the question that we're answering about what's the path to get you to where you are. And I'm going to take the opportunity to also answer a question that came in from the audience, which is, how do you take this path and become competitive after you've really been preparing for a career in a primary care specialty and you're sort of switching late to a surgical path?
Yeah, I'm happy to touch upon that. So, like ortho, neurosurgery, or any of the subspecialties, urology, uh, they're quite competitive to get into. So, the way I break it down, I break it into like 6 categories. One category is you have to have a CV that is competitive. It doesn't have to be the best, but it has to at least be competitive. So, if you decide late, therefore, you have to work on potentially making your CV a little bit more competitive before you apply. And so most people that apply in plastic surgery, I'd say more than 70% take 1 year off during medical school to do research and really ramp up their CV and their resume. So I think if you're interested in plastic surgery, I'd say it's almost a requirement these days. It's kind of sad, but that you have to take a year off and really dive deep and um, focus on research and publications. Um, the majority of plastic surgery programs are academic programs. And so regardless of whether you want to do academics or not, the people who are selecting you are academic plastic surgeons. So they're going to obviously have bias towards individuals who have research and publications. So I'd say I would do that, and that's what I did. I mean, I sort of combined a year with the business school, and during that time, I was doing research at the same time, and so I was trying to improve my chances on the plastic surgery side. So that's one. So having a academic portfolio that's competitive. Two, I would say work ethic in any surgical specialty. You can say like one is easier than the other, regardless. But the reality is, surgery is surgery. You have to have a work ethic that's strong. And so, and sometimes it's hard to showcase that. And so the way I approached that was, I let my actions do the talking. So I did 2 rotations, and I made sure I was the most hardworking student they've ever had in their life. I would never leave the hospital, and they would know that I was hungry and passionate about being a plastic surgery resident. And sometimes that's what it requires. And so you have to have some element of work ethic. So that's sort of a second bucket. A third bucket, I'd say you have to have some element of fundamental knowledge regarding the field. You can't step into an operating room and say, oh, I want to be an endocrine surgeon or urologist without having no idea about what that field entails. So for that year that I was doing research, I read this manual of plastic surgery, and I made sure I at least was familiar with the general principles regarding the surgeries I was scrubbing into. So having good fundamental knowledge, I would say teamwork. And you'll notice that a lot of surgeons are actually former athletes. Melissa's way better at me at soccer, but sometimes I'm better at her, depending on the day. But anyway, the point is, surgery is a team sport, and so people like to work with others that are team players. And so if you can somehow showcase that when you're rotating or working with others, that you're a team player, people will love that. I'd say having a passion for something within that field. It's also extremely important. And so being able to rotate through different specialties and figuring out what exactly you enjoy about one versus the other, what patient population you enjoy there, what type of surgeries you enjoy here, and being really cognizant of what you're passionate about can really inform others that this is something that's real, that you really enjoy and you will be successful in. And for me, it was always craniofacial surgery, changing the skeleton of the face and dealing with tumors of the skeleton of the face. And so, and has been my passion since day one. And so it was very clear with those I interacted with, that's what I wanted to do. And people love seeing that. They like to see someone that's passionate. And so, and I think the last element for plastic surgery in particular, you have to be very creative in our field. And that's something that I've seen people not do well in our field, is because maybe they wouldn't excelled in other fields really well. For example, if you really enjoy doing one type of thing and being like the master at that one thing and becoming really good at it, maybe plastic surgery isn't for you, because you ultimately have to be flexible in what you do in our field. So being a little bit more creative, being a little bit thinking on your feet is extremely useful. And as a student, you can tell if someone is like that or not. And so for plastic surgery in particular, that's one thing that you have to be pretty good at. And then lastly, I think everyone's mentioned that already, it's mentors and sponsors. It cannot be overemphasized. For me, it was a 72-year-old white male who really saw something in me and decided I want to mentor this brown kid from California, and he, really invested time and really helped me piece out the elements that I needed to get good at. For example, he knew immediately that I was very passionate and hardworking, but he knew I wasn't polished. So he was like, okay, we gotta work on how polished you are. So that's something I continually work on because that's something he identified in me. 3, he identified I was a terrible writer. And so he was like, you got to become a better writer. So, I mean, the things I write today compared to what I was writing even as this first year medical student, it's not even close. So I think having a mentor that can identify your weaknesses and being honest with you and direct, it can go a long way. Yeah, it hurts sometimes that you're being told you're not good at something, but you can't be good at anything unless you identify what you're not good at. And so I think if you sort of maneuver those 6 categories in some way, shape, or form, so that you move towards a better person, a better surgeon, a better clinician, a better doctor, you'll become a successful candidate in any surgical subspecialty.
Thank you so much, Dr. Lopez. I'm going to ask Dr. Camara Quintana to come back in and tell us what would be some top pieces of advice that he would share with aspiring surgeons.
I would say, I'd say just having the right attitude and just, I think in neurosurgery you have to have very thick skin, because the training is difficult, and so you kind of have to know how to let things go and be very self-motivated to kind of keep improving and working hard, and not be discouraged. And it's good to kind of surround yourself around friends and family. Obviously, sometimes it can be difficult to have family around, but I think the stronger support you have, the better. Just because things can get hard and challenging. Not to say that the whole 7-year process is challenging, but you'll definitely have ups and downs, and so it's good to have those resources.
And if you all can give us the top piece of advice that you would give an aspiring surgeon.
I would say the top piece of advice would be to just start getting into the OR and seeing if you enjoy it. I think that's the biggest thing is, do you like to be in the OR? I find it very, very, it's my happy place. So I think that's the first decision that you want to make is, do you like to be in the operating room?
Dr. Esparza.
Yeah, that's a hard one, but I guess I'd go back to kind of what I said before is just kind of building a good support system. So getting that experience in the OR, working with people in the field, and figuring out what aspects of that you really love, and then just working hard to get there. Treat everyone with respect. The nurses in residency and scrub techs and all, the support staff. I think that's a big thing through residency is treat everyone with respect, and they'll help you out. That'll make a huge difference throughout med school and residency. Definitely.
I'm just going to say I agree with everything that has been said, and one word: persistence. There's always going to be good days, there's always going to be bad days, but there has to be something that carries through the bad days. So some days are going to be great, some days are not going to be that great. You just have to stay focused and keep fighting for what you want. Usually surgeons, we just have this hunger and we don't want to get things done, and one way or another we're just going to get it done. And that doesn't matter which specialty you choose or how. You don't have to be a trauma surgeon to be like that, but it is something that drives us. And the second thing is you always have to have another way of decompressing. So keep something that really makes your life happy and brighter. I don't know, a hobby or a relationship or something else that can help you also get through when the bad days come.
I think what I would say for this biggest piece of advice would be uh, surgery is a calling. I think it comes with a lot of challenges, and you have to make a lot of compromises. And so, surgery chooses you. Don't choose surgery because you think it's prestigious or because it looks cool. It won't last. So choose it because it shows you and that's what you love. And so how do you find that out? So the way you find that out is find something in surgery that challenges you, that you find so intellectually challenging. You're like, wow, I really want to solve that. And then find the population within that field that you want to serve that has that problem. At least that's the way I did it, and that's sort of my personal story. For me, reconstructive surgery was challenging. It was intellectually stimulating, and I found a population that's completely underserved: kids with pediatric tumors of the face and neck. And now I've devoted my life to that, and now I have something to look forward to for the next 20, 30 years of my surgical career, and I will fight for those kids for the rest of my life. I have a calling now, and I have a field that provides that avenue. So I think if you find that challenge and you find that patient population you want to serve, you will have a very long career in surgery, and you'll be very satisfied. And the hurdles and the struggles along the way won't get in the way, because in the end, you have an end goal.
Have you faced any specific challenges being someone of Hispanic, Latino background, being underrepresented in medicine and obviously underrepresented in surgery? Have you faced challenges and how have you handled that?
I think I can answer that question. I think being still a trainee and being younger, obviously, a younger trainee, a young physician, I think that what I've experienced most difficult as a Latina surgical trainee is the interaction with nurses and patients. Actually, it's not the attendings. It's not being in the operating room. Even though in a male-dominated field as urology, it's going into a patient's room and the patient looking to me as their physician and not the tall white medical student. And it's the nurses respecting me as a physician and probably interacting with me a little bit differently than the the white male resident that they probably wouldn't interact with. And it's I can go on and on the microaggressions and the experiences day to day, but I think those are the interactions that are going to be most difficult as any trainee, I think.
They do persist when you are an attending. So I've been frequently confused with the nurse, or my first operation at another hospital, the circulator thought that I was the PA helping the surgeon. When I started asking for equipment, do you have this? Do you have that? I want this and with that. Then she looked at the ID and she just freaked out. So you just have to, you cannot blow up on everybody just because they don't know who you are. You just have to be nice about it, treat everybody with respect. And I just said, no, I'm actually the surgeon who's operating on this patient. I know we haven't worked together, but like we're going to be working together more often. So yeah, a little bit of thick skin and just being polite and respectful. Eventually, people are going to know that you're the physician. Eventually, they're going to know that you are the one providing the care. But it does still happen.
Yeah, I totally echo those and have had similar experiences, but I think kind of like what was said earlier, actions speak louder than words. So, the longer you're at a place, the more you'll prove yourself and people respect you for what you've done and how you're helping patients. And it can be frustrating at times, but I think, sometimes you just gotta let it slide and let your actions speak for themselves.
Yeah, I'll echo what everyone just said. Unfortunately, we live in a society where there's stereotypes and where people make quick assumptions just based upon the way you look. And so, as a minority and as a female surgeon, I can totally sort of relate that where you deal with that all the time. I mean, I've walked into rooms. I mean, oh, you're here for the trash. Here's the trash. I think people I'm the trash person. I'm the transport person. I'm going to transport the patient to the operating room. And you can't let those things sort of negatively impact your self-esteem, your perception of yourself. Because if you do, then unfortunately, it will place a toll on you. So, like everyone just said, maintain a positive attitude, keep your head up, be proud of what you've accomplished. I am living my dream. We are living our dreams. The challenges our parents face, for example, as recent immigrants, or the challenges we face probably as immigrants, are hard. But we have the privilege of working in a service-based profession where we're helping people every day. And I think in the end, those benefits outweigh the microaggressions or the narrow stereotypes that people may have when they first meet us.
Thank you for that. And I do want to just share that, not everyone's experience is the same. Similar to what has been said, I tend to just try to resort to a little bit of humor. And when I've been asked if I'm somebody else other than the surgeon or not meeting their expectations, I usually say, I can certainly step out and bring back a man surgeon for you. And usually the patients and the staff is, able to laugh it off. And we're able to move past that. And Dr. Quintana also was going to share with us his perspective.
Obviously it's going to vary, kind of individual, but, I from my perspective, I haven't had any issue, and I think it's been an added bonus, I think, to, all the programs and all the places that I've been. Obviously, there's a lot of Spanish-speaking patients wherever you train and do residency. And so I think, being that person that speaks Spanish and can communicate to people who are, Hispanic, Latino, whatever you want to refer to us as, I think it always adds a layer of benefit to sort of patient care and sort of assisting in that. So I know a lot of times, people are having trouble communicating to a patient or explaining things. And so just having that or being that face is always a huge win. Even now in my practice currently, just being able to, speak Spanish and be that familiar face just, makes a huge difference to sort of a big section of the patient population I treat. But I didn't experience in neurosurgery. It's very like it's based on merit, a lot of it, and so I don't think there's a lot of unfavorable kind of biases or anything like that. I think at the end of the day, as long as you do your work and you work hard and you want to learn, I think that neurosurgery, that's what it's all about. It's doing that. And I think coming from a different background is always a huge win.
All right, so with that, I'm going to ask for you. I did ask our panelists to share with us a single summary. I'm going to ask the staff if you can please pull up the slides for us, and we'll go ahead and give everyone a chance to wrap up the session.
And can I just say that I think I kind of missed the memo on what the slide was supposed to include. So mine is just a kind of picture form of what my bio was and has a bunch of pictures of myself. Hopefully that's okay.
Why don't you go ahead, Dr. Esparza?
Actually, I think a bunch of the pictures got cut out. I actually had a great one that included Dr. Lopez from our medical school from our undergraduate graduation without the beard, and then kind of a 10 years later at our reunion. But I kind of, again, some of them are missing from my slide, but just wanted to kind of reinforce the forming mentorship and support with colleagues throughout your training was kind of one thing I highlighted.
Okay, I think I saw Dr. Vargas-Pinto's slide in there.
Oh, okay. So I wasn't sure exactly what to include, but I just wanted everybody to know. So general surgery is usually 5-year programs. You can come in as a categorical resident, which means that you will be able to, hopefully you meet the milestones along the way. You will be to complete your training in 5 years. You could come in as a preliminary resident for 1 year, and then you have to try again and see if you will match as a categorical in another program. We do have a board certification, so that means we have a written and an oral test after we completed residency. For that reason, we have in-training exams, which is important for you to do well to be considered for fellowship interviews and things like that. There's a lot of areas in general surgery that you can specialize from. That's one of the things that are beautiful from it. So I have listed all of them, or most of them over there. Fellowship programs are usually 1 to 2 years in length. Some of them have their own board specialties exams, like surgical oncology, colorectal. In general, you have to, I would say, choose whatever you want to do depending on number 4. What are your personal skills, your abilities, what is your life goals? What are your career opportunities? But that's pretty much it. 5 years of training, you're trained to do a wide variety of surgeries, and you can choose to focus your specialty in something that you particularly liked.
Dr. Gomez?
Sure. So I just wanted to highlight mainly the variety of what urology brings. So it's female and male. So it's the urinary tract of men and women, and the urinary tract of women and the genital urinary tract of men. We deal with patients of all ages, from babies doing circumcisions or orchiopexies, bringing down their testicles, to elderly adults with cancer, kidney stones, BPH, and then I just wanted to highlight also in the middle that we're a surgical specialty, and I love that we can provide surgical treatments or surgical options to treat many of our pathologies, but there are many medications that we're trained to prescribe, and those are the first line therapies that we can offer for patients for some of our pathologies. And then the key thing I wanted to highlight was that our surgeries are also there's a lot of variety in our surgeries. We do endoscopic surgeries. So on the top, on the right side of the slide, we have a cystoscopy, cystoscope to look in the bladder. We do ureteroscopy for stone treatments, and we go laser the stones and take them out. We do laparoscopy and robotic surgeries. And then that's me and my attending, who also is from LA. And we were doing an open cystectomy. So we do open cases as well. It's a great variety, and it's why I love urology. And just to actually mention, because Dr. Vargas-Pinto did a great job of mentioning the specific training, urology is 5 to 6 years. And it's actually a great option if you love general urology. So I actually really love general urology. I love doing a wide variety of things. And I've decided not to do fellowship and to just do general urology. It's a great option it is a viable option in urology. Sometimes some specialties, like if you internal medicine, you kind of have to specialize sometimes to and it's an additional amount of training. So yeah, that's urology.
Dr. Lopez.
So the points I point out here are related to just how to choose a surgical specialty, not necessarily plastic surgery related, but I'll emphasize some points that have already been mentioned during the session. One, I'd say explore all the subspecialties: ophthalmology, urology, ENT, orthopedic surgery. If you have an inclination towards surgery, explore every single one of them, because I think every single one of them is very unique and has its own very challenging aspects of it, and it can be also very satisfying. So I think explore all the options and look at the entire scope of the subspecialty and what they do. And for me, nothing is perfect. No specialty is perfect. There are some elements of specialty you may not enjoy. However, if you can't tolerate it, then you probably shouldn't do that. So I think you have to really look at it very carefully. And so look at the entire scope of that practice. The other thing is, don't choose a specialty based on the personalities of those in that specialty, okay? Unfortunately, historically, surgery itself has not been a welcoming field for a very long time. And yet we still went into it. And I think it's because we all found something that really, really enjoyed it. And for me, I'll be honest, I did not find like residents or attendings that I really connected with when I was rotating through plastic surgery. However, I really enjoyed the surgeries. So I had to look past that and really make sure that I was focusing on the work, not on the personality. So I think that's something that's very important. I think choosing its especially is a very personal decision. When someone chooses based on their own factors, personalities and desires and emotions and needs, it's a very personal decision. So it may work for Melissa or Gigi or Dr. Vargas, it may not work for me. So I think it's a very personal decision. So really dive deep and really figure that out, whether it's right for you. And I think lastly, there are inequities in surgical care delivery in any of the specialties we've mentioned today and those that we haven't mentioned. So I think if you have an interest in health disparities or addressing those health inequities, there is a population for you waiting out there for you to help. And the various specialties will offer that. Not one or not the other, but all of them. So you just have to find those patients that need you. So I think really do your homework and really figure out what you want to do. And, right here on the right, I showed a couple photos of the type of cases we do in plastic surgery. So there is a kid with a cleft lip that came in back in January that we did a cleft lip repair. On the right there is a patient that we did orthognathic surgery where we cut the bones of the maxilla and the jaw, the lower jaw, to reposition the teeth so that they can bite better. And then so at the same time, be able to look better. And then the bottom there is a kid that came in with a fused suture in their skull. And so their brain was not expanding normally. And they were having elevated intracranial pressures. And so we had to reshape the entire skull to elevate the elevated intracranial pressures and reconstruct in such a way so they looked a little bit more normal and hopefully does not impact their ability to have a normal neural developmental sort of brain. So in general, I think these are some general principles to look into when choosing a specialty, I think.
Thank you. Dr. Esparza, did you want to add anything?
Sure. I guess I didn't really talk much about what in general, for what we do in orthopedics, there's a lot of different subspecialties. I'm peds ortho, and that's probably one of the most general fields within orthopedics. But there is hand surgery, there's spine surgery, there are joint replacement, so arthroplasty, shoulder and elbow sports. I'm definitely missing, leaving out some, but there's a huge variety of different subspecialties even within ortho. And then just these three things I kind of have along the bottom here, just list a couple of the different like specialty or societies within ortho that specifically for minorities or women. I think I left the women's one out, which is the Ruth Jackson Society. but Nth Dimensions is one that is specifically for medical students that has a program to encourage underrepresented in medicine to look at ortho as a field. There's American Association of Latino Orthopedic Surgeons and J. Robert Gladden as well, or just a few other resources. And again, there's that picture of baby-faced Dr. Lopez up there before he got the distinguished Ivy League beard. So
just clarify, are you pointing at this top corner in the baby blue shirt?
That would be it.
I embrace it now. Thank you, Melissa. Thank you.
No problem.
And I'm just going to ask if we can go, Dr. Camara Quintana also prepared a slide, and what he wanted to say is that, you know, people who choose neurosurgery definitely are highly motivated, generally interested in neuroscience, and really actively involved in research. You have to have a passion for neurocritical care, and you want to really desire a life that is both demanding and rewarding in terms of experiences for people that are afflicted with neurological disorders. Neurosurgery encompasses the subspecialties of brain oncology, trauma, peripheral disease, pediatrics, functional epilepsy, vascular, and spine surgery. A 7-year residency training program with the option of 1 to 2 years of postgraduate fellowship training tends to be the path for most neurosurgeons. There are currently 140 neurosurgery training programs, and across the US, a total of 800 training positions. And there are approximately 3,689 neurosurgeons in the US treating a population of 300 million people. So definitely a huge need in the field, really in all of the fields. And so we really thank you for the time that you've spent with us today. We want to thank our attendees for taking the time to come and learn with us. And this video will be posted in the video sets that will be posted with the NHMA conference. So with that, I invite you to continue to enjoy the rest of the sessions and connect with us, Latino Surgical Society, on social media at Latino Surgery, or on our website, latinosurgicalsociety.org. Thank you so much to our panelists. Enjoy the rest of your day.